Hi, I'm Dr. Nathan, and today on my first official YouTube Vet Talk, we're going to talk about, well, maybe not one of my favorite diseases, but a disease that is near and dear to my heart. My first horse, the one that taught me to ride and took care of me while I was learning what it was to ride and handle horses, whether it was on the trail or in the thick of battle on a Civil War reenactment, well, he started to get this coat of long hair. Every summer, he looked like a woolly mammoth because his winter coat never disappeared. We got to the point of giving him full body clips because of the long hair, and sometimes he would get some respiratory infections, usually in the heat of the summer. I remember looking back and feeling bad once I got into vet school because looking back at my memories with just a glance, I knew this was Equine Cushing's disease, or pituitary pars intermedia dysfunction, PPID. If only I'd known what this was earlier, I could have treated him sooner, right? I mean, that's silly. I wasn't a vet. As soon as I learned about it, I made the diagnosis, except I wasn't a doctor then, so I couldn't really make a diagnosis. But that horse lived to 31 years old, and the Cushings, I would like to say, was well managed when the diagnosis was made and treatment started. He had respiratory problems for the rest of his life, and I always wonder if earlier management would have prevented some of the pneumonias he fought through. But when a horse makes it to 31 years and was happy for his entire time with my family, one can't really complain. It turns out we had a total of 3 Cushing's horses on the farm. So far, I'm watching my new horse closely. But overall, as we had roughly 20 horses, that seems statistically about right, as 20% of horses over 15 years of age will have this disease. My thought is, if horses lived to 90, every horse would have Cushing's. Statistically, that may be accurate, though likely never proven, as horses don't live that long. But as 30% of horses greater than 30 years have the disease, I think I'm on the right track. This is a picture of one of our horses that didn't develop the disease until he was in his 20s. This picture was when he was young and not showing any signs of the disease. As owners and vets, we don't know which horses will develop Cushing's. But let's get down to the nitty-gritty of Equine Cushing's. What is Equine Cushing's? Well, as its PPID version of the name says, it's a dysfunction of the intermediate lobe of the pituitary gland. The pituitary gland is in the brain. I tend to tell clients that it's a cancer of this gland. Not the, oh my gosh, we're going to die cancer, but a cancer that pumps out certain hormones which affect the body. My explanation, while good for a client, isn't quite true. The gland does expand, but where cancers are broken cells, these cells are just enlarged. The gland expands through mechanisms we don't quite understand and then can affect the body by putting pressure on nervous tissue surrounding the gland. I don't think I'll change my explanation to clients because my explanation gets the point across, but in all honesty, it's not quite accurate. Physiologically, there is a loss of innervation due to oxidative stress, which will cause hyperplasia of the intermediate lobe of the pituitary gland. This innervation causes a lack of dopamine, which increases something called POMC peptides, which then increases ACTH, which regulates cortisol. Naturally, in the fall, the pineal gland, due to decreasing light, will secrete melatonin, which causes what I just described to occur naturally, which makes the body prepare for winter by doing such things as increasing hair length. This is why I tell people Cushing's is worse in the winter, because the body is naturally causing the same symptoms on top of the disease, which is also causing symptoms. Most vets start relating to this disease when we talk about cortisol and ACTH, as that is what we see in our dog counterparts, which have Cushing's disease. In dogs, this disease is primarily more adrenal-based, which is a big difference from horses. What do these changes cause in the body? Well, most often the owners come for the biggest and easiest way that equine Cushing's is diagnosed: hirsutism, or probably more properly, hypertrichosis. This is a long hair coat that makes them look like a woolly mammoth. I've driven by farms and diagnosed horses with Cushing's from a field away. And you can make a diagnosis with this clinical sign, but there is more than just that to look for. As a vet, I hope to diagnose Cushing's a little earlier than the woolly mammoth presentation. Which, as a side note, I keep seeing how people want to bring back mastodons and woolly mammoths. And it looks like we got some dire wolves back. I'm not sure if this is a good idea, but I would certainly volunteer to work on those animals. Or dinosaurs if someone is making a resort off the coast of Costa Rica. Or if Amelia Clark needs anyone to work on her dragons. Just saying, even if it's a bad idea, I'm game. Until I get a call from one of those billionaires to fix their genetic projects, I'll work to try to prevent people from having woolly mammoths. The long hair coat is sometimes patchy over the body, or the owner complains that the hair shed out in the summer later than the rest of the horses. Or we may, if we are being astute, notice long strands of hair under the jaw or on the legs, which tends to be the first place I will see the hair from Cushing's disease. And it's not just slightly long. The hair on the leg and below the jaw may be inches long and dangling. Excess hair is just a great way to diagnose Cushing's. However, I will note I have been fooled sometimes, especially with some ponies or miniatures that have naturally longer hair coat to begin with. I've tested a few of these animals, received negative results, and the owners are like, Doc, they've been this way since we had them. I'm also curious about Icelandics. My wife has an Icelandic, and besides my Passos, have been my favorite type of horse I have met. As it says in their name, they are from Iceland, where, well, it's more winter-like. As it says in their name, they are from Iceland, where, well, winter has already come. There are darker days up there, so the pineal gland in these horses are more likely more active, and thus makes these horses look like they have Cushing's. And the Icelandics, I know, generally have longer hair, longer than most of the horses I see. Granted, down here in America, I still see them shed out. I'd love to talk to a vet in Iceland to discuss with them Cushing's disease and how much they see with Cushing's up there. Or are Icelandics just slightly evolved to naturally be a little more Cushionoid? If any vet from Iceland wants to reach out, I'd love to have a conversation with you about this disease and how it affects Icelandics in Iceland and Icelandics in America. However, there are other signs to see besides long hair coat. Abnormal fat distribution. Typically, we see fat accumulate in the neck region or above the eyes in the supraorbital fat pads. A lot of people tell me they think the horse's belly is getting fat, which in a manner of speaking, they see the belly look large. But it's not getting fat, it's getting weaker abdominal muscles due to the cortisol. So the intestines aren't held in place as much and the animals look more rotund. Like in dogs or cats, horses can also be PU and PD, or drink more and pee more. But I don't think I've ever had an owner tell me, nor have I been able to notice that, because these horses are in the field and the owners typically doesn't see how much they urinate. They may have an idea how they're drinking, but it's still challenging if there are multiple horses in the field or if they drink from a pond. One thing that took me a while to realize is the horse may be docile as well. I didn't realize this because I didn't know the horses that I initiated treatment on. But while not all clients have said this, many have come back and said once the Cushing's was controlled, they saw a younger horse, or a horse that acted more energetic. Cushing's, with the cortisol increase, also weakens the immune system. I have seen this display in a variety of ways. Chronic skin infections and chronic respiratory infections, as my horse had, are the most common. The respiratory infections I tend to see were in temperature extremes. I've also seen high number of parasites in these horses, and weight loss from the high number of parasites. Typically, horses will be able to fight off roundworms in their older age. So if I see a roundworm in a 15-year-old horse, I'm starting to wonder about Cushing's, or an underlying disease that is damaging the horse's immune system. I've also seen fungus and tumors, such as bovine papilloma tumors that grow without being able to be checked. Again, things that the immune system can normally fight off, they can't now because it's weakened. Lastly, one of the other signs I see is Cushing's horses can be excessive sweaters. Again, all that extra hair causes extra heat in the body and extra sweating. When do we see this disease? Well, it kind of depends on the signs to a point and what people are paying attention to. This is a fall and winter disease, as it is worse in the fall and the winter. But most clients don't notice a full hair coat in the winter, or they're happy to have it because it keeps their horse warm. So most clients notice it in the summer when they think their horse shouldn't have a full hair coat. The other signs depend on the horse's lifestyle and external factors. For example, that full hair coat in a warm winter might cause rain rot in the winter. The humidity trapped in the fur on a 70-degree day in January is not kind to the skin. The last thing, and unfortunately what has led to diagnosis, is sometimes chronic laminitis. If you want to know more about laminitis, listen to my podcast about laminitis. But one of the things that we worry about in horses is giving high doses of steroids for long times. Well, all that cortisol released for an extended period is in the body for a long time, and cortisol is a steroid. One of the first things I think about in laminitis is Cushing's. Farriers don't have the tools and aren't trained to think that. Too often, clients just let the farrier manage a case of laminitis. If your horse has laminitis, it needs to be the client, the vet, and the farrier all working together, partially for that very reason. So the vet can come and make sure the laminitis is not due to underlying Cushing's disease. Even hoof abscesses, if they become chronic, may be a signal of chronic laminitis. And while it is fulfilling to drain a hoof abscess, and I'm okay with a farrier doing that, if the abscesses become common, the vet needs to be called because that might show laminitis. Or it might show that there's an underlying problem such as Cushing's. Those are some of the things you may see with a Cushing's case. The two most problematic are respiratory infections and laminitis, because those are manifestations of this that actually kill the horse. Other than the secondary effects of those diseases, Cushing's itself doesn't kill horses. These are the things I'm looking for when I go out to a horse and consider working towards a diagnosis of Cushing's. Either I see a long hair coat and I start thinking about breed disposition and age, or I see something else going on and wonder if we need to test for Cushing's, i.e. a fat horse or a horse with laminitis. Now just take a look at this hair. This hair is much longer. This hair has been clipped, and you can see how long this hair is compared to this hair, which is still clipped. Also, here is a horse that we're managing for laminitis. Look at the angle here. We know we have laminitis, and we're taking steps to treat that, but this horse had underlying Cushing's disease as well. So the first thing, do I need to run a test to diagnose this? As I've said, no. If I see all the signs, I don't mind just treating for Cushing's disease. However, I like running blood tests to be able to monitor the Cushing's disease as it progresses. So I'm obviously going to push for some blood tests and to complete them annually. How do we test for Cushing's disease? First, like in dogs, I like running a CBC chemistry. There are things in the blood work which may point me or help me confirm Cushing's disease. For example, often in horses, insulin tends to be high when they have Cushing's. But the test I've used since I graduated, and I think is the best way for us at the moment to diagnose Cushing's, is the endogenous ACTH. It's 71% sensitive and 79% to 100% specific. I've had good luck with this test. It's a simple blood test with EDTA or purple top tubes. When I went to school, they were telling me how as soon as you drew the sample in the field, you had to put it on ice packs and rush it back to school and separate the plasma, freeze it, and send it to the lab. As one of my vet students found out, if you don't cool the blood, the enzymes will degrade and the lab will not be able to run the sample, or the sample will have falsely low results. But recent studies have found you don't have to rush as much as we previously thought. Cool it with ice packs and go about your day, and the results will be fine. If the horse trailers into the clinic, they say wait about 30 minutes to draw blood after trailering, because the excitement of the trailer can bring about false positives. Otherwise, there are reference intervals for various times of the year for what is considered positive or negative. They say you should test every 3 months until you get this controlled, but I find this unreasonable to ask of clients, so I just test yearly and adjust dosage based on clinical signs. The biggest problem with this test is there are false negatives early in the disease. I have multiple horses in my practice that I'm watching, and I know at some point they're going to come down with Cushing's disease. But yearly tests and not seeing extremely strong clinical signs at the moment are proving me wrong. But what do we do when we have a positive horse? It's certainly not a death sentence, since many of the horses I have treated for it make it into their 30s. I even had one horse I was able to stop treating once they got older, as the disease seemed to regress. If we can prevent the worst signs, laminitis and respiratory problems, the horse can be competitive and have a normal working life. But this does require management. So what are our treatments? First, the two things that don't work. Chinaberry. I've had clients try this supplement, and when I test, this just doesn't bring values down. It's a waste of clients' money. The second thing is compounded drugs. So for years before the FDA came out with its version of Pergolide, called Presend, which I'll talk about soon, I used compounded drugs. This compounded Pergolide was usually compounded into a syrup, and I had success with treatment, but it was not always reliable, or it was inconsistent success. Some of the problems with these compounded drugs is their stability decreases, and even though I might prescribe a vial that had the contents of 60 to 90 days, the drug would only last for 30 days, at best, before it was not effective. Some compounds need to be refrigerated, some compounds don't need to be refrigerated at all, but all of them need to be protected from light. Combine that with the variability of compounded drugs, and well, at the time I was using it, it was the best we had. That being said, I don't recommend the compounded drugs anymore. I don't think it's wrong to use them, but I had much more success and reliability of treatment with Presend, the FDA-approved Pergolide. What does Pergolide do? It is a daily supplement that counteracts the loss of dopamine. Boehringer Ingelheim makes this drug, and it comes as a pill. Typically it's a pill a day. You can throw it in the feed, and the horses generally will eat it, as it's small enough they don't notice it. My family tends to mix it in water. It dissolves by the time we walk out of the house, and with a syringe we squirt it in the horse's mouth to make sure the horse gets its dose. The other nice thing is once it's built up in the system, I'm okay if I miss a dose. Now, don't take that as me saying I recommend skipping doses, but if you are away for the weekend and have been on this drug for months, the world will not end. As far as dosing goes, I typically start off on the daily tablet and then go from there. I see some horses only need Cushing's medication in the fall and winter when the disease is at its worst. Some I go down to every other day dosing in the spring and summer, but it depends. And how do I determine this? Well, clinical signs and testing. If your horse has PPID in the winter, I'm going to recommend a steady dose, but in the spring and summer, if signs are resolved, the first year I might have them drop down to every other day. Sometimes they can even stop, but I have them start back in the fall. because I know the disease is going to get worse. But remember, we make these dose adjustments over time. Since I recommend all horses that start with the treatment get percent in the fall and winter months, it may be a year before I am comfortable decreasing the dose. What helps is testing so I can see the trends and numbers. The test results are reflective of the time of the year. Numbers will naturally be higher in the fall and winter. But since we've run this test so much, the labs have accounted for this. Still, I try to be consistent with testing. While we could test multiple times a year, I tend to test once a year as it becomes a burden to clients to test more than that. I try to keep the testing time consistent, but people's lives sometimes don't allow this. But I look at the numbers, gauging all this information, time of year, previous numbers, and then recommend increasing or decreasing the dose based on if it looks controlled. And I always bring clinical science into this decision, not just the numbers of the test. The more testing you can do on a Cushing's horse, the better your vet can chart the horse's course for dosing. We have a safe and effective drug, and I find we can usually manage Cushing's horses well if we pay a little attention to them. As horses live longer, we will see this disease and should be aware of it both as a horse owner to ask your veterinarian to test for it, and as vets to make sure we can keep horses comfortable and prevent bigger problems. I'm Dr. Nathan. Thanks for listening. I hope our discussions are valuable to you and aid in giving you perspective. If you want to contact us, please reach out to theveterinarypodcast@gmail.com. Please subscribe to and like our YouTube channel and share with others. For more information, please join the Patreon at patreon.com/theveterinarypodcast. Membership is free and you can decide what other information you may want to purchase to support our work. Thanks for listening, and I hope this perspective can help us improve the world.